The itch is perhaps the most underrated yet most agonizing sensation a human can endure, because it is not just a minor annoyance, but a form of perpetual low-grade torture. It is the silent scream of your peripheral nerves, which is a command your brain cannot ignore. And we have all felt the need to scratch because it is an ancient evolutionary reflex meant to dislodge parasites or irritants. But the critical question is, what if the irritant is not external? And what if the relentless command to scratch comes not from the air, but from the blood itself? What if that unbearable, week-long itch is not a problem with your skin, but is instead a desperate, coded message from your internal organs, which is a warning that should not be ignored? For decades, we've been trained to look for dramatic symptoms, like searing pain, a noticeable lump, or sudden bleeding. But in my 25 years of practicing oncological medicine, I have learned the terrifying truth that cancer rarely arrives with a roar. It begins instead with a whisper, and often that whisper sounds exactly like an incessant, unyielding itch of pruritus that refuses to yield to moisturizers, antihistamines, or even prayer, which is not a coincidence. This unyielding itch is what we call a Paraneoplastic Syndrome, and you should imagine your body as a high-security facility where the tumor is the intruder. Before the intruder is large enough to set off the main alarms like pain or organ failure, it starts deploying biochemical agents, specifically inflammatory molecules, hormones, and peptides, into the system. These substances travel through the bloodstream, crashing directly into your delicate nerve endings. And they do not cause pain, but instead confuse the nerves, overriding the normal signals and issuing only one frantic command: scratch. According to the National Cancer Institute's longitudinal studies, a shocking number of patients, over 40% in certain cancer types, reported a persistent, unexplained itch for months, or even years, before their diagnosis. Today we begin our investigation with the lower legs, a location that few doctors immediately connect to cancer, because the location of this primal urge is everything. I want to introduce you to Camila, a vibrant, 72-year-old grandmother, who walked into my office having already seen 3 different dermatologists without getting relief. Dr. Castillo, she confessed. Her eyes red not from tears, but from chronic sleep deprivation. 8 months, this burning itch in my shins has been driving me insane. She recounted her ritual that late at night the sensation would arrive, and it was not on the surface like a mosquito bite, but deep, as if the itch was originating from the bone itself. She would scratch until the skin bled, applying every over-the-counter cream imaginable, including hydrocortisone, heavy petroleum jellies, and specialized anti-itch lotions, but nothing worked. The dermatologist dismissed it as senile xerosis, which is dry skin due to age. But Camila had an instinct, telling me firmly I know my body. This is not dry skin, this is something else. She was tragically and prophetically correct about her body, sending a warning. So we needed to investigate further than the surface of the skin. When I examined Camila's calves, the skin appeared misleadingly normal, with no rash, no visible inflammation, and no scaling, just the telltale scratch marks of sheer desperation. I explained to her the mechanism that the others had missed, because we were looking for lymphoma, which is a cancer of the lymphatic system that often starts in the lymph nodes, but circulates its chemical byproducts throughout the body. The key players here are immune messengers called cytokines, specifically interleukin-31, IL-31. Which is a potent pruritogen and itch-inducing chemical released in excess by certain cancerous immune cells, particularly those found in Hodgkin's lymphoma. The reason it concentrates specifically in the calves and shins is a cruel combination of gravity and circulation. Because when you are upright all day, and especially when you lie down for the night, the circulatory system slows. Blood return from the feet and lower legs is dependent on muscle contraction, making it the slowest part of the vascular network. And this sluggishness, coupled with gravity, causes these inflammatory cytokines, these tiny chemical alarm bells, to pool and concentrate in the lower extremities. When these concentrated IL-31 molecules land on the dense nerve endings in the skin and subcutaneous tissue of the shins, they trigger a continuous, unrelenting nerve response. Camila's analysis was spot on because the itch wasn't coming from her skin. It was coming from her blood, making it an itch of systemic inflammation. Further testing, which included a comprehensive blood panel showing abnormally high white blood cell counts, followed by a lymph node biopsy. Confirmed as stage 1 Hodgkin's lymphoma, but thankfully she caught it early. Dr. Camila told me 6 months later, her voice steady and clear after successful treatment. If I hadn't listened to that persistent itch, they would have found it much, much later. This isn't just a story about a specific cancer, but it's a lesson in differentiation. Because you need to understand the characteristics of a lymphoma itch versus a common itch. The lymphoma, which persists and is unyielding, lasting for weeks or months without a single day of relief, and it does not wax and wane like a common irritation. The location is often concentrated around the calves pantorrillas and shins espinillas, making it specific to the lower legs where circulation is slowest. The timing is critical because it frequently worsens dramatically at night, preventing sleep when circulation slows down the most and allows the cytokines to pool. Most importantly, it completely ignores common remedies, meaning antihistamines offer no relief, because this is a non-histamine-mediated nerve disorder, and creams are useless because the problem is internal, deep in the blood chemistry. If you recognize these 4 specific characteristics in an itch that you or a loved one has been dismissing, it is not simply dry skin, and it is a sign that demands a deeper investigation into your systemic health. Beyond the superficial layer of the epidermis, the scalp, which is that dense vascular canopy covering our thoughts, is an area rich with nerve endings and capillaries, making it a critical barometer for the most subtle changes in blood composition. When the blood itself begins to betray the body, the first whispers of chaos can often be felt here, not as a surface itch, but as an electrical storm. The story of Alejandro, a 71-year-old history professor, taught me a profound lesson about the importance of listening to the truly insignificant complaints that patients often minimize. Alejandro visited my clinic almost by accident, simply accompanying his wife, but while waiting, he finally confessed, almost apologetically. "Dr. Castillo, I know this sounds ridiculous, but for 6 months, my scalp has felt ... weird." He described it as a constant tingling, like tiny ants marching across his head, with no dandruff, no dryness, and no rash, just that buzzing sensation, which is not the superficial flaking or inflammation of common dandruff or dermatitis. This deep, unnerving sensory anomaly is what is medically termed paresthesia or formication, the sensation of insects crawling on or under the skin. And when it is persistent and unexplained, it can be a critical sign of systemic hematological disorders. In the case of leukemia, which is cancer of the blood or bone marrow, particularly chronic lymphocytic leukemia (CALE), the body produces a massive, uncontrolled proliferation of abnormal white blood cells, lymphocytes. These leukemic cells do not function properly, and critically, they cause the blood to become unusually thick, which is a condition known as hyperviscosity or hyperleukocytosis. The scalp is crisscrossed by an incredibly dense network of fine capillaries that are essential for nourishing the hair follicles and skin. But when the blood flow slows and thickens due to the sheer volume of abnormal cells, these capillaries become congested. Imagine a busy highway suddenly flooded with too many oversized vehicles, causing the traffic to grind to a halt, which is similar to how the blood can barely push nutrients and oxygen through the smallest vessels in the scalp. This congestion and sluggish microcirculation directly impact the sensory nerves in the scalp. And the nerves, starved for oxygen and irritated by the metabolic byproducts of the crowded cells, begin to misfire. They do not register pain or dryness, but instead register a phantom signal, the constant, subtle buzzing, tingling, or electrical feeling that Alejandro described. When we conducted a rapid blood analysis for Alejandro, the results were exactly what I feared: a significantly elevated white blood cell count, confirming chronic lymphocytic leukemia, but in a very early pre-symptomatic stage. The strange scalp sensation had been the only visible sign of the disease, providing an invaluable early warning that saved his life. Beatrice, a retired teacher, reported a similar experience, an electric hum in her scalp that intensified every afternoon. And she described it as feeling like her brain was short-circuiting, manifesting as a non-stop tingle. She had spent months trying expensive anti-dandruff and antifungal treatments, which offered no relief because the problem was located in her circulatory system, not her epidermis, which is the key distinction. We detected her elevated blood markers, just as her body was quietly ramping up its production of cancerous cells. And her prognosis, like Alejandro's, was excellent because her body, through that tiny neurological signal, raised the alarm early. The quality of the sensation in leukemia is more of a tingling, crawling formication, or electrical vibrating sensation, rather than the sharp, satisfying urge of a common itch. Crucially, there is no visible cause, meaning no rash, no dry flakes dandruff, no scaling, and no obvious dermatological inflammation, so the skin looks entirely normal. It is completely unresponsive to anti-itch shampoos, steroid creams, or treatments aimed at fungal or surface issues, because the problem is not on the skin. The mechanism is the result of deep circulatory congestion and nerve irritation, which signals changes in the composition of the blood itself, specifically in the bone marrow. The scalp, with its high density of nerves and vessels, provides a vital, often ignored window into the health of your bone marrow. So if you experience this persistent, unexplained electrical sensation, it warrants immediate, high-level blood work. Not just a trip to the pharmacy for a new shampoo. Of all the life-saving warnings an itch can deliver, the one associated with the breast is perhaps the most urgently overlooked. Because we are culturally conditioned to look for the traditional signs of breast cancer, such as the lump, the firmness, or the mass that can be palpated. However, one of the most aggressive and insidious forms of this disease, inflammatory breast cancer, IBC, follows none of the rules because it begins not with a lump, but with an alarming, unrelenting dermatological complaint. Valentina, a vibrant 58-year-old saleswoman, came to me after a devastating merry-go-round of misdiagnosis, and she shared, for 4 months. My right breast has been scratching constantly, especially around the nipple. She saw 2 gynecologists and a dermatologist who told her it was a bra allergy, excessive perspiration, or maybe a yeast infection, but she had changed everything: detergent, soap, fabric, and deodorant, yet the deep burning sensation persisted, often waking her from sleep. Crucially, she felt no lump in her breast, which is why her symptom was so easily dismissed by other doctors. When I examined Valentina, the skin of her breast appeared deceptively normal at a distance with no classic rash and no discharge, but upon close inspection, and more importantly, upon touch, I noticed 2 subtle, yet critical details. First, the texture. The skin around the areola felt slightly thicker, almost like a subtle edema or firm peel. And second, the temperature. The affected area was distinctly warmer to the touch than the other side. Valentina, I explained, the cancer we are looking for is called inflammatory breast cancer, and it does not form a mass. It forms a sheet. IBC is a rare but highly aggressive type of cancer where the malignant cells, instead of clumping together, infiltrate and plug the tiny lymphatic vessels in the breast's dermal layer. These vessels are the drainage system for the skin, and when they become blocked, fluid cannot escape, which leads to rapid, systemic inflammation. This blockade causes 2 primary symptoms that are often mistaken for common skin issues. First, the itch, where the trapped inflammatory fluid and metabolic waste from the rapidly growing cancer directly irritate the sensory nerve endings in the breast tissue. This creates the deep, unyielding, burning itch that topical creams cannot penetrate. And second, the heat thickening, where the buildup of trapped fluid causes swelling and heat. This can lead to the classic peau d'orange orange peel texture, where the swelling pulls the hair follicles inward, but in early stages, it only manifests as subtle thickening and warmth. The medical community's failure to recognize this initial symptom costs precious time, because the difference between a simple antibiotic cream and an immediate biopsy could mean life or death as IBC progresses rapidly. Gabrielle, another patient, described the sensation as a fire under the skin that started near her nipple and gradually spread to her armpit, following the lymphatic routes. We were able to detect her IBC early, leading to a favorable outcome because we acted swiftly on the symptom of deep, persistent warmth and itching, not waiting for a lump. For men watching this, while male breast cancer is far rarer, the principles of IBC remain the same. So any unexplainable, persistent warmth or itching in the chest area should be evaluated immediately. You should not assume it is limited to female anatomy. The IBC itch is persistent, lasting over weeks or months, and cannot be traced back to a specific new product or fabric. The quality is often described as a burn or deep heat accompanying the pruritus, which is a critical clue. Visual clues are key. The area feels warmer to the touch than the surrounding tissue, and you should look for subtle changes in texture, such as a slight firmness or thickening of the skin, even if no visible rash exists. The critical differentiator is the absence of a lump, which makes it easy to dismiss. But it is precisely the hallmark of this dangerous, diffuse cancer. A chronic burning itch in the chest area, especially one accompanied by subtle warmth or skin changes, is an urgent call for help from a body whose internal drainage system is being systematically sabotaged. The final zone we must discuss is the anogenital origin, the one most shrouded in silence, shame, and taboo, because this is the region where an intense chronic itch is most frequently dismissed. It is either dismissed by the patient, out of sheer embarrassment, or by the physician, who defaults to diagnoses of hemorrhoids, fungal infections, or poor hygiene. Yet ignoring the persistent itch in the anogenital region can have the most fatal consequences, simply because the delay in seeking help is often the longest. The tragedy of Edmundo, a respected 69-year-old architect, is a painful lesson in the cost of modesty, because he arrived at my clinic only after his wife insisted, having suffered in silence for over a year. "Dr. Castillo," he confessed, his voice barely a whisper, eyes fixed on the floor. "I have had a terrible itch in the anal area, and I thought it was hemorrhoids." He tried every cream, changed his diet, and avoided spices. But the itch woke him up at night and drove him crazy, yet he was too embarrassed to bring it up. He had self-medicated, self-diagnosed, and suffered months of escalating pruritus. And when I conducted the necessary examination, the severity of the situation became instantly clear. Hidden just inside the anal canal was a small, irregular lesion of squamous cell carcinoma anal cancer that had been slowly growing, masked by the overwhelming symptom of chronic itching. The anogenital region is lined with highly sensitive mucous membranes and transitional epithelium, which is highly reactive to change. In both anal and vulvar cancers, the early tumor growth releases a complex soup of chemical irritants, including proteases enzymes that break down protein and various inflammatory mediators directly into the local tissue. These powerful enzymes and toxins don't just cause inflammation, but they actually begin to digest and disrupt the delicate nerve endings and epithelial lining. The result is an intense, constant itching and burning sensation, which is a physical reaction to the cellular destruction occurring beneath the surface. The critical differentiator is persistence and unresponsiveness, because common causes of anal itching are often cyclical, related to bowel movements, or respond quickly to basic topical treatments. The cancerous itch, however, is a biological constant. It worsens progressively, is often concentrated to one distinct spot, and is entirely unaffected by treatments for common ailments. Catalina, a 65-year-old patient, experienced a similar situation in her vulvar region, suffering from an intense localized itch on her labia majora for 8 months, which she attributed to menopause and age-related dryness. When she finally overcame her shame and consulted me, we detected vulvar cancer in a very early stage, and she said after her successful treatment, "I genuinely thought this was a normal part of getting older. The anogenital itch is constant and progressive, lasting over 3 weeks, and steadily worsens, which is a major red flag. It may be unilateral or localized, focusing intensely on one side or a specific small area, rather than being a generalized irritation. It fails to respond to standard treatments for yeast, hemorrhoids, or eczema, because the root cause is deep within the tissue. You should look for subtle accompanying signs, such as changes in the skin's texture or color, a slight thickening, pallor whitening, or a small non-healing lesion, even if it seems minor. Your life is worth more than a moment of discomfort or embarrassment, and if you have a persistent itch in this area, your immediate responsibility is to your health, not to social taboos, so seek a full evaluation immediately. After more than 2 decades in oncology, my most profound conclusion is that your body is the most sophisticated self-diagnostic tool ever created. The 5 signals we have dissected: the deep, nighttime ache in the calves, the electrical hum on the scalp, the hot, constant scratch on the breast, and the unyielding itch in the anogenital region are not random, but specific manifestations of systemic diseases. They are your body's way of raising a quiet flag long before the official sirens sound. So do not panic, because not every itch is cancer. The vast majority are benign, easily treated, and quickly forgotten. The goal is to move from passive ignorance to empowered discernment. So you must learn to distinguish the common itch from the cancer itch by being precise in your definitions. The common itch tends to come and go, usually resolving quickly within days or a week once the trigger is removed. But the cancer itch is persistent and unyielding, lasting for weeks, months, or even years, offering no single day of genuine relief. The common itch usually responds well to standard remedies like moisturizers, topical steroids, or over-the-counter antihistamines. But the cancer itch is completely unresponsive to common topical treatments because the chemical signaling is deep within the blood or nerve endings. The common itch is often accompanied by a visible rash, redness, scaling, hives, or obvious dryness, xerosis, while the cancer itch is frequently a melanotic, no visible rash, because the irritation is neurological or systemic, not epidermal. The common itch is superficial, often described as a tickle, and is usually relieved temporarily by scratching. But the cancer itch is often deep, burning, electrical, or neurological in quality, frequently worsening dramatically at night, and scratching provides almost no lasting relief. The common itch is often generalized or shifts from one body area to another. But the cancer itch is specific and fixed in one of the zones we discussed: the calves, the scapular region, the scalp, the breast, or the anogenital region. I implore you, do not minimize your symptoms out of fear, modesty, or the simple assumption that you are just getting old. The difference between successful treatment and a devastating prognosis often rests entirely on your willingness to listen to the whispers of your body and demand a deeper medical investigation, a blood test, or a specific scan when the superficial answers fail. Be your own advocate, because your health is the most important investment you will ever make. And if this information is valuable, please share it. The power of medical information, accurately conveyed, can save a life, perhaps the life of someone you love who is suffering in silence.